Right now, 37 million Americans are living with damaged kidneys. 1 in 3 of them has no idea, no symptoms, no diagnosis, nothing on their radar. By the time most people find out, they are already in a hospital bed asking how this happened. Here is what nobody explains clearly enough. Your kidneys do not fail out of nowhere. In the final 24 hours before a crisis, your body sends very specific distress signals, clear ones, obvious ones, if you know what to look for. But most people either miss them completely or blame them on something harmless, bad food, a rough night, getting older. Your heart pounds when it is struggling. You feel it. Your lungs make you gasp when they cannot get enough air. You notice. But your kidneys are different. They are the quietest vital organs in your body. They suffer in silence, filtering, adjusting, compensating, until they hit a wall. And when they hit that wall, things move fast. That is what makes kidney failure so dangerous. Not the failure itself, but the silence that comes before it. By the end of this video, you will know exactly what those final warnings look like, what is actually happening inside your body when they appear, and what to do the moment you recognize one, what you are about to hear. Nobody at your next appointment is going to walk you through this in enough detail to actually help you. Most people think kidneys do one thing, make urine. That is like saying your brain just thinks. It is technically not wrong, but it misses almost everything that matters. Your kidneys are a full chemical processing plant running 24 hours a day. Every single day, they filter roughly 180 liters of blood. They regulate your blood pressure through a hormone system called the renin-angiotensin system. They balance sodium and potassium so your heart beats in a steady rhythm instead of going haywire. They produce a hormone called erythropoietin that tells your bone marrow to make red blood cells. They activate vitamin D so your bones can actually absorb calcium. Remove the kidneys from the equation and every one of those systems collapses. The basic filtering unit inside each kidney is called a nephron. Think of it as a microscopic coffee filter, except this filter also decides what to keep and what to throw away, and it adjusts itself thousands of times per hour, depending on what your body needs in that moment. You have roughly 1 million of these nephrons per kidney. And here is the part that changes everything. They do not regenerate. Once a nephron is destroyed, it is gone for good. Your body does not build a replacement. That is why the warning signs matter so much. By the time your kidneys start sending distress signals you can actually feel, a significant number of those nephrons have already been destroyed. You are not catching the problem at the beginning, you are catching it near the end, and what you do in the next 24 hours determines whether the damage stops here or becomes permanent. The biggest myth about kidney failure is that it happens suddenly. One day you are fine, the next day you are in the hospital. That is almost never how it works. In medicine, there are 2 kinds of kidney failure. One is acute kidney injury, where something hits the kidneys hard and fast, a severe infection, a reaction to a drug, a sudden drop in blood flow. That can develop in hours to days, and in many cases it is reversible if caught quickly. The other is chronic kidney disease, where damage accumulates silently over years and then crosses a threshold. Most so-called sudden kidney failure in people over 50 is actually that second kind. Years of quiet damage reaching a tipping point. Think of a dam. For years, tiny cracks form in the concrete. Water seeps through in amounts so small nobody notices. The structure still holds. Then one day, the weakened wall gives way and water comes flooding through. That final collapse looks sudden, but the process behind it took years. Your kidneys work the same way. The causes that build those cracks are predictable. Years of uncontrolled blood pressure physically scars the tiny vessels inside the nephrons. Diabetes coats those same vessels in sugar damage, thickening their walls until blood can barely pass through. Chronic use of certain over-the-counter pain medications quietly erodes kidney tissue from the inside, and most people taking them have no idea that is happening. The 24-hour warning window does not come from nowhere. It comes at the end of a long road, and that road had earlier exits you may have missed. So what does that final warning window actually look like? It starts in the place most people never bother to check, your toilet bowl. Healthy urine has a clear to pale yellow color, a mild odor, and no visible texture. When kidneys enter crisis, that picture changes dramatically, and the changes are visible if you take 2 seconds to look before you flush. The first change is foam. Not a few bubbles that pop immediately. Persistent, thick foam that sits on the surface and does not dissipate, like someone poured soap into the bowl. That foam is protein. specifically albumin that is spilling into your urine because the nephron filters are breaking down. Remember that coffee filter analogy? When holes start forming in the mesh, things that should stay in the blood start pouring through. Protein in the urine is one of the clearest signs that those filters are failing. The second change is color. Dark brown or cola-colored urine suggests blood breakdown products or a protein called myoglobin leaking into the filtrate. On the opposite end, very pale, almost water-clear urine produced in unusually large volumes suggests the kidneys have lost the ability to concentrate. They are letting water pass through without properly processing it. The third change is volume. Either you are producing almost nothing, under 400 milliliters in a full day, a condition called oliguria, meaning the kidneys have essentially stopped filtering, or you are suddenly flooding the toilet with dilute, watery urine, because the nephrons can no longer regulate how much fluid they release. Here is the critical point. Most people never look at their urine. They flush, they walk away. That 2-second glance is one of the earliest diagnostic tools you have access to every single day, and it costs you absolutely nothing. Most people see puffy ankles or swollen fingers and think water retention, too much salt last night, stood on my feet too long. That kind of swelling is real, but it behaves differently. It shows up in the legs after a long day and fades by morning. Kidney-related swelling does the opposite. When your kidneys can no longer manage fluid balance, the edema is symmetrical, both sides equally. It pits, meaning if you press your thumb into the skin of your shin and hold for 10 seconds, a dent stays behind. And here is the detail most people miss. It is often worst in the morning, especially around the eyes and face. You wake up looking puffy, and by afternoon it shifts downward into the hands and ankles. That pattern is not cosmetic, it is diagnostic. Here is what is happening inside. When nephrons fail, they lose the ability to excrete sodium properly. Sodium stays in the blood, and water follows sodium, always. So fluid volume rises and has nowhere to go. It backs up into your tissues. There is a second mechanism running at the same time. Remember the protein leaking through those damaged filters? That protein, albumin, is not just waste. In your bloodstream, albumin creates what is called oncotic pressure, a force that keeps fluid inside your blood vessels where it belongs. When damaged kidneys dump albumin into the urine, blood albumin levels drop, oncotic pressure falls, and fluid starts escaping through vessel walls into the surrounding tissue. Your circulatory system is literally losing its ability to hold water in the right place. This is not puffiness from a salty dinner. This is a body that is losing control of one of its most basic functions. You have now learned 2 warning signs that most people dismiss entirely. Urine changes, they never bother to look at. Swelling, they blame on age or diet. The question is not whether you understand them. You do now. The question is what you actually do next. Most people watch a video like this, feel a flash of concern, and go back to their day. But the people who avoid a crisis are the ones who take one small step while the information is still fresh. Here is what I would tell you if you were sitting in my office right now. Get screened. Do not guess. Do not wait for symptoms to get worse. Find out where you actually stand. Care Health is a free platform that connects you with kidney screenings, blood work panels, and clinical trials for kidney disease and related conditions in your area. You fill in a short form, date of birth, gender, whether you have children under 18. Takes about 30 seconds. No cost, no commitment. Care Health matches you with relevant options near you. Click the link in the description below, or scan the QR code on screen right now. Just open your phone camera and point it at the code. I would rather you get screened and find out everything is fine than sit on a warning sign and find out too late. Now back to what your body is trying to tell you. If you suddenly cannot catch your breath, the first assumption is always your lungs or your heart. Even some doctors on a busy day will reach for that conclusion first. But in the final hours before kidney failure, breathlessness often has nothing to do with either organ. The source is somewhere nobody expects. The first mechanism is metabolic acidosis. When your kidneys fail, they can no longer excrete hydrogen ions or regenerate bicarbonate, the chemical buffer that keeps your blood at the right pH. Acid builds up. Your body recognizes the emergency and launches its backup plan. It forces you to breathe faster and deeper to blow off carbon dioxide and compensate for the rising acid. This pattern has a clinical name, Kussmaul breathing. Deep, labored, almost gasping breaths that feel like you are suffocating even though your lungs are completely clear. A chest X-ray would show nothing wrong. because nothing is wrong with the chest. The problem is chemical, not structural. The second mechanism is fluid overload. Kidneys that cannot remove fluid mean that fluid has to go somewhere. It backs up into the lungs, seeping into the tiny air sacs where oxygen exchange happens. This is called pulmonary edema. It produces a wet, crackling sensation when you breathe and a suffocating feeling when you lie flat. People prop themselves up on 2 or 3 pillows at night just to breathe and assume it is a heart issue. The third mechanism is anemia. Failing kidneys stop producing erythropoietin, the hormone that tells your bone marrow to make red blood cells. Red cell counts drop. Oxygen delivery to your tissues falls. You feel winded climbing a single flight of stairs and blame it on being out of shape. 3 completely separate mechanisms, all producing the same sensation. I cannot breathe. None of them starting in the lungs. The fourth warning sign does not come from your chest or your legs. It comes from your mouth. When your kidneys can no longer clear waste products from the blood, a condition called uremia develops. Urea, creatinine, and dozens of other toxins that should have been filtered out begin accumulating in the bloodstream. They affect every organ, but the gastrointestinal system is often the first to react. It starts with a taste, a persistent metallic or ammonia-like flavor in your mouth that will not go away no matter what you eat, what you drink, or how many times you brush your teeth. That taste is urea circulating in your blood, reaching your saliva, and being broken down into ammonia by bacteria in your mouth. You are essentially tasting your own metabolic waste. Then comes the nausea, not the kind that follows a questionable meal and passes in an hour. This is a steady, grinding nausea that sits in your stomach all day, sometimes with vomiting, and it does not match anything you ate. Your appetite vanishes, not because of stress or depression, but because those circulating toxins are chemically irritating the lining of your stomach and interfering with the appetite centers in your brain. Some people describe food suddenly tasting wrong in ways they cannot explain. Others develop a specific aversion to meat because protein-rich foods produce more urea when digested and the body instinctively recoils. Here is what I see in clinical practice over and over. When patients show up in emergency departments in acute kidney failure, the majority report that they felt sick to their stomach for a day or 2 beforehand and assumed it was something they ate. The nausea was the kidney's last distress signal, and they interpreted it as bad leftovers. The fifth warning sign is the one that frightens families the most, because it changes who you are before anyone understands why. Your brain is exquisitely sensitive to the chemical environment of your blood. It depends on a narrow range of electrolytes and a clean supply of plasma to function. When kidneys fail, that environment falls apart. Potassium rises, a condition called hyperkalemia. Sodium swings unpredictably. Urea and other waste products that should have been filtered out cross the blood-brain barrier and interfere directly with how neurons communicate. The result does not look like a medical emergency at first. It looks like you are just off. Sudden mental fog, difficulty concentrating on a conversation, confusion that comes on over hours in a person who was sharp that morning, extreme fatigue that a full night of sleep does nothing to fix. In more severe cases, genuine disorientation or agitation that family members mistake for the beginning of dementia. The potassium piece deserves a closer look because this is the mechanism that kills quickly. Hyperkalemia does not just cloud the brain. It destabilizes the electrical system of your heart. The heart relies on precise potassium levels to generate its rhythm. When potassium climbs past a critical threshold, the heartbeat becomes erratic, then dangerously slow, then it stops. Kidney failure does not typically kill through the kidneys themselves. It kills through a cardiac arrest triggered by a potassium level the heart cannot tolerate. There is also the sleep disruption that patients rarely connect to their kidneys, restless legs that will not settle, involuntary muscle twitches, called myoclonus, that jolt you awake, a feeling of never being rested, no matter how long you stay in bed. Here is the pattern to burn into your memory. If unusual mental fog or crushing fatigue appears alongside any of the previous warning signs, urine changes, swelling, breathing difficulty, nausea, that cluster is not a coincidence, that is a body in crisis. Now I want to shift from what the warning signs look like to something you may have more control over than you realize. The medications sitting in your medicine cabinet right now. This is where one of the most important blind spots in modern medicine lives, not in what doctors prescribe, but in what nobody adds up. The combined kidney load of everything you take. Start with NSAIDs, the over-the-counter pain relievers millions of people use daily. Ibuprofen, naproxen, they work by blocking chemicals called prostaglandins. The problem is that those same prostaglandins are what keep the afferent arteriole open, the tiny vessel that delivers blood to each nephron. Block the prostaglandin, and you reduce blood flow to the kidney's filtering units. Take these chronically for joint pain or arthritis, and you are slowly starving your nephrons of the blood supply they need to survive. Next, proton pump inhibitors, the medications prescribed for acid reflux that many people take for years without a second thought. Research has linked long-term PPI use to chronic interstitial nephritis, a slow inflammatory process that damages kidney tissue from the inside. Then add certain blood pressure medications. Many of them are genuinely heart protective, but they alter kidney blood flow in ways that require regular monitoring of kidney function, monitoring that many patients do not receive consistently enough. Here is where it gets dangerous. A person over 55 taking an NSAID for knee pain, a PPI for reflux, and a blood pressure medication for hypertension may be hitting their kidneys from 3 separate directions at once. And nobody is connecting the dots because each prescription came from a different doctor or a different visit. The message is not to stop your medications. The message is to have one specific conversation with your doctor about your combined kidney load. Ask for a blood test that includes serum creatinine and estimated glomerular filtration rate, called eGFR. That single test can reveal how much filtering capacity you have already lost. It takes minutes, and it can change everything. Now, the most practical part, what do you actually do if you recognize these signs in yourself or someone close to you? The first rule is simple. Do not wait until Monday. Do not tell yourself it is probably nothing. If you recognize 2 or more of these warning signs happening together, especially urine changes plus swelling plus nausea or confusion, that is an emergency department situation, not a phone call to your doctor's office, not a wait-and-see situation. That combination is a body telling you its filtration system is shutting down, and hours matter. When you get to medical staff, 3 pieces of information will save them critical time. 1. A complete list of every medication you take, including over-the-counter pain relievers and supplements. 2. A clear timeline of when each symptom appeared. 3. Any history of diabetes, hypertension, or kidney problems in your family. Now, what not to do. Do not take extra doses of any medication, thinking it will help the kidneys recover. Do not massively increase your water intake to try to flush the problem out. A failing kidney cannot process that extra fluid. You are not flushing anything. You are flooding a system that has already lost the ability to drain, and that worsens the overload. Do not take potassium supplements. If your kidneys are failing, potassium is already climbing toward the level that stops a heart. For those watching who do not have symptoms right now, this is your prevention window. Ask your doctor for an annual blood panel that includes serum creatinine and eGFR. Ask about a urine albumin to creatinine ratio test. Have your blood pressure evaluated with kidney health specifically in mind, not just heart health. Kidney failure is not a death sentence when caught at the warning stage. Many cases of acute kidney injury are fully reversible if intervention happens within that narrow window. The people who lose that window are the ones who waited. So let me leave you with this. Your kidneys warn you before they fail. Foamy, discolored, or dramatically changed urine. Symmetrical swelling worst in the morning. Breathlessness with clear lungs. A metallic taste and nausea that nothing explains. Mental fog and crushing fatigue alongside any of the above. Those 5 signals are not random discomfort. They are a system telling you it is running out of time. The biggest risk factor for kidney failure is not your age, it is inaction. It is seeing the signal, feeling the concern, and deciding to deal with it later. Later is how people lose kidneys that could have been saved. Everything we covered today is for your understanding and your education. Your situation is specific to you. Use this as the starting point for a real conversation with your doctor, not as a replacement for one. And remember, that free health screening link is in the description. 30 seconds could make a real difference. Take care of yourself.